Hello and welcome to my YouTube channel. In today's video I will explain about the 12 most dangerous viruses on Earth. Vertical bar on globe Earth. Today, vaccines and antiviral drugs are available for some viral infections. Moreover, since 1977, an extremely deadly viral infection, smallpox, was totally eradicated, and since then no case of the disease has occurred. However, we are still far from winning the fight against viruses. In recent decades, several viruses have passed from animals to humans and caused considerable disease outbreaks, causing thousands of deaths. The strain of the virus that caused the 2014-2016 Ebola epidemic in West Africa killed 90% of infected people, being the deadliest member of the Ebola virus family. On the other hand, the new SARS-CoV-2 coronavirus, which caused the global COVID-19 pandemic, although it has a low fatality rate, still represents a threat to people and medical services. The following 12 viruses are considered the most dangerous. Marburg virus. For the first time, Marburg hemorrhagic fever, the disease caused by the Marburg virus, was recognized in 1967 when in the city of Marburg, hence the name of the virus. In Germany, a large number of cases appeared among laboratory personnel who came into contact with green monkeys infected Africans, recently brought from Uganda. The virus is common in Africa, in Uganda, Angola, Kenya, Zimbabwe and South Africa. In Germany, at that time, the mortality rate was 25%. According to the World Health Organization, WHO, the Marburg virus caused epidemics in Congo during 1998-2000, and in Angola in 2005, whose mortality rate reached 80%. Ebola virus. Similar to the Marburg virus, infection with the Ebola virus causes Ebola hemorrhagic fever, an extremely serious disease, with an average mortality rate of 50%, but which in the case of certain strains, can reach 90%, the highest mortality caused by a disease viral, with the exception of rabies. Transmission of the virus is easily done through direct contact with the blood and other body fluids of an infected person. The disease is most frequently found in Africa, the first infected patients being diagnosed in 1976 in the Democratic Republic of Congo and Sudan. It is considered that the Ebola virus is present in wild animals from the sub-Saharan African area, such as fruit bats, chimpanzees, gorillas and antelopes, and human infections have been achieved through direct contact with them. Rabies virus. It determines rabies or rabies, a viral disease of mammals. Rabies has been identified since ancient times. It is transmitted to humans through the bite of infected animals. Most cases of rabies in humans are the result of dog bites. Bats and foxes can also infect humans. The rabies virus from the animal's saliva penetrates through the skin or mucous membranes and ends up destroying the brain, producing a diffuse meningoencephalitis. The period of time until the appearance of the first symptoms depends on the distance the virus has to travel to the central nervous system, varying between a week and over a year, on average being 1-3 months. Once the patient is infected, if the treatment, rabies vaccine and sometimes rabies immunoglobulin, is not administered quickly enough, the mortality rate is 100%. While the rabies vaccine for animals has been introduced since 1920 in developed countries, which has caused the number of cases of the disease to become extremely low, in India and some parts of Africa, rabies still remains a serious problem. HIV. HIV is the English abbreviation of human immunodeficiency virus. It is considered the most dangerous and lethal virus of the modern world. It belongs to the family of retroviruses and as a result, it cannot be completely removed from the body because it has the ability to write its genetic information into the genetic code of the host cell. HIV infection causes AIDS, acquired immunodeficiency syndrome, after a long incubation period of years or even decades. In the world, 1 million patients with HIV die every year, in some countries being the main cause of death. However, today there are effective antiretroviral drugs that have made HIV infection a chronic medical condition. Many infected patients live for decades. More than half of HIV patients, approximately 20 million, had access to treatment in 2017. In the world, at the end of 2019, there were 38 million people with HIV, two-thirds being in the WHO African region, 25.7 million. Unfortunately, 95% of new cases of HIV infection occur in people from underdeveloped countries. Smallpox virus. Smallpox was one of the most devastating diseases known to mankind and caused millions of deaths before it was eradicated. 1 in 3 infected people died. Survivors were left with deep permanent scars and frequently lost their sight. It is believed to have existed for at least 3,000 years. The smallpox vaccine, created by Edward Jenner in 1796, was the first vaccine developed that proved its effectiveness. Starting with 1967, the WHO started intensive vaccination at the level of the globe, so that 10 years later, in 1977, in Somalia, the last case was diagnosed. Since then, no case of smallpox has occurred. In 1980, the WHO declared smallpox eradicated, the only infectious disease that received this distinction. This is a notable example of success in the field of public health. Hantavirus. There are several types of hantaviruses that are transmitted to humans from mice and cause severe damage to the lungs. Hantavirus pulmonary syndrome and kidneys. Hemorrhagic fever with renal syndrome. The first cases appeared in 1993 in the United States. Until now 700 people have been diagnosed, of which 36% have died, according to the Center for Disease Prevention and Control, CDC. Influenza virus. WHO estimates that during a typical flu season, 290,650,000 people worldwide will die from the disease. But occasionally, when a new strain of flu virus appears, a pandemic results with a faster spread and often a higher mortality rate. The influenza pandemic of 1918, known as the Spanish flu, was the most severe pandemic in recent history. It was caused by a new type of flu virus, H1N1, whose genome was of avian origin. The virus spread all over the world during 1918-1919. In the United States, it was identified for the first time among military personnel in the spring of 1918. It is estimated that approximately 500 million people, or one-third of the world's population at that time, were infected with this virus. The number of deaths was estimated at least 50 million worldwide. Dengue virus. Dengue fever is a viral infection transmitted by mosquitoes that is common in warm tropical areas. The first cases appeared in the 1950s in the Philippines and Thailand, and the disease spread to the tropical and subtropical regions of the globe. The global incidence has increased dramatically in recent decades. About half of the world's population is now at risk. It is estimated that approximately 100–400 million people become infected each year. There is no specific treatment for dengue fever. Early detection of the progression of the disease to the severe form and access to adequate medical care have reduced the mortality rate from 20% to below 1%. Rotavirus. Rotavirus is the most common cause of severe diarrheal disease in young children worldwide, according to WHO estimates. In 2008, approximately 450,000 children under the age of 5 died due to rotavirus infection, which, moreover, can be prevented by vaccination. Unfortunately, the vast majority of these children live in low-income countries. WHO recommends the introduction of vaccination in national vaccination programs. Countries that have introduced vaccines have reported a considerable decline in deaths and hospitalizations. SARS-CoV. Severe acute respiratory syndrome, SARS, is a viral respiratory disease caused by a new type of coronavirus, SARS-CoV. The discovery of this virus was the result of an unprecedented collaborative exercise coordinated by the WHO. The virus was identified for the first time at the end of February 2003 during an outbreak that appeared in China and spread to 4 other countries. SARS-CoV is transmitted by air through respiratory droplets, similarly to colds and flu, and secondarily through contact with contaminated surfaces. SARS was the first severe disease, which can be easily transmitted, which appeared in the 21st century, and which demonstrated the clear role of the spread of infectious agents played by international air flights. In just a few months, SARS-CoV spread to more than 44 countries in North America, South America, Europe and Asia before the epidemic was controlled. Approximately 8,000 people contracted the disease. Most of the patients were healthy people, aged between 25–70 years. The mortality rate was 3%. The last reported case was a patient in China, diagnosed in April 2004. Teams of researchers in Hong Kong and Shenzhen detected several coronaviruses genetically closely related to SARS-CoV in animals purchased from a market in southern China, where animals were sold wild for human consumption. Mast civet, Paguma larvata, and other species. It was a first indication that the SARS-CoV virus can exist outside the human species. SARS-CoV-2. It is the new coronavirus that the whole world is currently facing. It was discovered for the first time in December 2019 in Wuhan, China. COVID-19, the disease caused by SARS-CoV-2, has an estimated mortality rate of 2.3%. According to the WHO, in January 2020, there were 95,612,832 confirmed cases of COVID-19, of which 2,066,176 died. The risk of developing a severe form of the disease is increased in this case for the elderly and those suffering from other chronic diseases. In December 2020, 1 year after the first case of COVID-19, vaccination against COVID-19 began in the European Union. Romania uses vaccines recommended by the European Medicines Agency and authorized by the European Commission. MERS-CoV, Middle East Respiratory Syndrome, is a viral respiratory infection caused by a new coronavirus, MERS-CoV, which was first identified in Saudi Arabia in 2012. It is a zoonotic virus that is transmitted to humans from dromedaries. It has been identified in several countries in the Middle East, Africa, and South Asia. It belongs to the same family of viruses that SARS-CoV and SARS-CoV-2 are part of, and it is assumed that it comes from bats, being later transmitted to camels. It has a mortality rate of 35%, being the most lethal virus in the coronavirus family. YouTube channel Alexandru. Thank you for watching this video clip to the end. I hope it was a video clip from which you learned something. Understand, if you like this video clip, don't forget ***** subscribe, give a like, a share on social networks, so your friends know cut this clip.